My name is Dr. David Krasnow. I practiced optometry in Beverly Hills for 45 years. Now I do healthcare consulting internationally, working mostly in Central America and the Middle East. I have a history of COVID where I was hospitalized 2 years ago for 7 weeks. I went into respiratory failure and kidney failure. And where the doctors expected me to die, I didn't, I survived. But as a result, I had scarring in my lungs, I had an inflamed heart, and my diabetes was not well controlled at all. So I decided that it was time to get more aggressive with treatment for my variety of medical conditions, and that's why I sought out stem cell treatment. The conventional treatment that I had was taking lots of pills. I was on prednisone, I was on insulin, and I was taking 15 pills every morning. And I was feeling better, but my diabetes was not improving. My heart inflammation, which was a pretty rare condition of COVID, I was only the third person in the world to have what's known as aortitis, which is an inflammation of the aorta. And I have a history of open heart surgery as well, so it was a concern to not only me, but all my doctors. And after about a year of treatment, I wasn't really improving significantly. So I decided to do some alternative medicine. And that's when I sought out the stem cell treatment in Antigua. Well, as a medical person for decades, and also with a public health background, I started looking all over the United States for potential stem cell treatment. And I found out that in the US, they only allowed treatment for joint problems, for hips, for knees, elbows, and they do injections. And I realized that I didn't have any medical condition for which injection of stem cells was an alternative. So when I was doing my research, I found the Stem Cell Center in Antigua and realized that they had a state-of-the-art center, and their doctors are all board certified, highly qualified. So I made a phone call and sent all my medical records. I sent images of my lungs. I sent all my lab work, and I did heart profile, I did an EKG, I did a Holter monitor, and my blood work. I tested everything that I could test. And as a medical professional, I wanted all pre-op data so I could compare it to post-treatment. And so I sent volumes of lab tests, x-rays, CT scans, heart scans. And they said they thought I was a good candidate for the stem cell treatment. So I made my reservations and flew to Antigua. When I flew from Las Vegas to Miami and from Miami to Antigua, when I landed, I was met by one of their staff, the staff driver. He picked me up at the airport and drove me to a really nice hotel, Hodges Bay. Had excellent accommodations, good food, nice swimming pool, a beach. I was impressed. And this was a fellow who would be escorting me from the hotel to the clinic and back every day. The first morning I was picked up at the hotel, driven to the clinic, and where my surprises started coming in rapid succession. It was a beautiful building. When I walked in, I was greeted by their staff. The place was immaculate. It was state-of-the-art. I practiced in Beverly Hills for 45 years. I know what state-of-the-art is. They brought me into a treatment room and they explained what they were going to do. And I was looking at the waiting room, the pre-treatment room, the treatment rooms. It was literally state-of-the-art, but state-of-the-art to the highest standard of the best U.S. clinics. So they had done an incredible job building and equipping the building. When I was in the pre-treatment area, they greeted me, they explained what they were going to do, and I was going to have a series of IV infusions. The treatment would take 4 days. The first 2 days would be infusions. The third day would be an infusion of a vitamin compound that they put together. And the last day I had my final infusion. I had, where a lot of treatments are 50 million stem cells, I had 200 million stem cell infusions. The nurse who took care of me was very skilled. There's no pain, it's just an IV. And I had, I think the first treatment was almost 100 million cells. It takes about 45 minutes to an hour for the infusion. And they were talking to me the whole time, totally comfortable, not a problem at all. I went back to the hotel and relaxed. The next day I had another treatment, second infusion, and they give you these fruit cocktails that are vitamin rich, so you get that after every infusion. It was delicious. The third day, which is a massive vitamin infusion, very much like the stem cell treatment. The fourth day was my last stem cell treatment. The only side effect is I had chills for about an hour after the treatment. So I just went back and took a nap for about an hour, and that was the only side effect I had. I stayed one more day, and then I packed it in and left Antigua. I felt good after the treatment, but I had a real good, I was comfortable, and I wasn't having medical problems that were overt. So for the first week or so, I didn't tell any difference. When I came back home in Nevada, I noticed I had a little more energy, but I couldn't put my finger on anything. Before I had the treatment, I had a lot of lab tests, CT scans. I was told it would take 3 to 6 months to take effect. And at about the 3-month mark, I went in for blood work and some more scans. And at the 3-month mark, the remarkable thing is that my glucose, which is a measure of diabetes, had been, my A1C was 8.4. And all that means is 8.4% is not a well-controlled diabetic. And about 3 months later, it was down to 7.1, which is rapidly heading towards normal. So that was a side benefit that I had no idea would happen. And we never talked about it at the clinic. So I realized that it improved my diabetic condition, which continues to improve. The other thing that I noticed is that my breathing had improved. And I was on oxygen for a total of 4 months, and using a walker when I came home from the hospital. I no longer used oxygen. I couldn't run a marathon. I was a cross-country runner in college, but I could walk much greater distances post-treatment than pre-treatment. The other thing that surprised me was I went in and had more cardiac tests, cardiac enzymes, which are a measure of heart inflammation. And I had aortitis, inflammation of the aorta. And as of today, it's about 90% improved. And I learned that stem cells go first to the lungs and then the heart. And my two major problems were scarring of the lungs and breathing problems, and a very high heart rate. My normal rate is 60 to 80, and mine was in the 120s and 130s, which is a very rapid heartbeat. And for someone who has a history of cardiac problems, that can be fatal. My heart rate now is in the 70s and 80s, which is relatively normal. My enzymes, which are way out of whack, showing that I had inflammation, my inflammation is at least 90% improved. So that's a life-saving change from pre-treatment. I went in for a lung scan and found out that my lungs had improved markedly. I probably have residual 10 or 15% scarring from the COVID. It's called ground glass scarring, but my lungs cleared up probably 50% at the 6-month mark. So that was a second blessing of the stem cell treatment. And I have way more energy now. I'm not sleeping 12 hours a day. I'm back to my normal 6 or 7 hours. And I attribute that to the stem cell treatment. All my lab work is largely normal now, and many of my readings have been very abnormal. I know that I'm one of the first patients to have detailed lab work and CT scans pre and post. So I actually have hard data that the stem cells made a significant effect on my lungs, my heart, and all my blood work. The interesting thing is a number of my friends have asked me about the treatment, and my doctors, most significantly my pulmonologist. My pulmonologist wanted to open a stem cell center in Nevada, and the government wouldn't let her do that. So she was the one who strongly recommended I go to Antigua for treatment. When she saw the improvement, she has decided she's going to start referring patients directly to the clinic. I have some other friends with similar cardiac issues and diabetes. So I have requested that they go down to Antigua and get the treatment because they can't find any similar treatment here in the US. The other significant difference between the stem cell center in Antigua and those in the US and elsewhere is the quality of the stem cells is amazing. It's probably 98-99% viable stem cells. And there are other clinics that have viability of 40 or 50%, which means half of the stem cells which are infused are dead, and dead stem cells don't do anything. So the quality of stem cells in Antigua is very impressive. So I've made about 6 referrals to the clinic in Antigua now. The cost is an issue, so I have some people who don't have financial issues and they will pay the fee that they're quoted. The others are trying to raise money. And it's not inexpensive, but it was worth every penny that I paid. So I refer people to the clinic with full confidence. Because of the amazing changes that I've had with my heart, my lungs, my pancreas, and my rapid improvement in diabetes, I plan to go back again this summer for another round of stem cells. I want to be 100% clear, free of inflammation from my heart, and I think it'll improve my lungs even more. So I think overall it'll make a dramatic effect from where I am today as opposed to where I was the first time. I'm happy to spend the money. It's an investment in my future. It's an investment in my overall health care. So I'm pretty excited to go back.